Tonight, an investigative report on a growing danger in prescription drug abuse. Cronkite News is dedicated to tracking the use of opioids across Arizona. The highly addictive drugs not only affect the user, but their loved ones as well. One of those drugs is fentanyl. Investigative reporter Karla Liriano is in the broadcast center with the troubling trend.
It's the drug that killed Prince earlier this year. Just a few grains of fentanyl can be deadly. As part of our ongoing project on drug addiction, I found out what makes this drug so dangerous when it gets out on the streets. Just this year, Pima County has seen 260 opioid overdose victims come through this morgue. Medical examiner Greg Hess says more and more of those deaths involve a dangerous painkiller called fentanyl.
When that type of drug enters the supply for people that are substance abusers, they have a increased propensity to overdose on that medication because it's more potent than what they're used to.
Pima County had 7 fentanyl-related deaths in 2014. That number jumped to 17 in 2015.
Essentially, it reflects the prevalence of the drug in the community, as we were describing. So the way that the drug is smuggled into the United States and where it goes and who's buying it and who's distributing it.
In the medical field, fentanyl is meant only for patients suffering from the most severe pain, but it's also causing concern among law enforcement who are seeing it in drug busts across the country.
What we suspect is that large quantities of fentanyl, pure fentanyl, are arriving into the country, and then it is being used to adulterate tablets.
Agents with the Drug Enforcement Administration say fentanyl originates in China, is smuggled into the U.S. from Mexico, and often disguised as prescription pills or mixed in with other street drugs.
The traditional dose that a heroin user takes, if it's got fentanyl in it, it will kill you. And you won't even know it's there sometimes, but it will kill you.
This poses a threat to the officers who seize these drugs.
Counterfeit tablets, they appear to be one drug, but when we go to analyze it, we find that there's fentanyl in that. So law enforcement who might stumble across it in a traffic stop or something and accidentally get exposed could have some very dangerous effects.
But fentanyl abuse isn't limited to just street drugs.
There's always the risk for the diversion of pharmaceutical-grade fentanyls from hospitals, medical practitioners, and even patients.
This father of 5 started using fentanyl while working as a nurse anesthetist. After administering it to a patient, he injected it into his own arm.
The heavens parted, the angels sang, those temporary problems that I was experiencing went away. And just for a few minutes, life was okay again.
6 months later, he sought treatment for his addiction.
This disease doesn't discriminate. It can touch anyone. You can be a priest, you can be a minister, you can be a high school arts teacher, you can be the doctor that you go see for your ailments.
Stewart's decision to go seek treatment allows him to keep his job where he still treats patients every day. With the investigative team, Karla Liriano, Cronkite News.
Cronkite News is taking an even deeper look into the problems of opioid addiction. If you or your family has faced opioid abuse, we want to hear your story. You can go online to cronkitenews.azpbs.org to fill out our online query.